Hello, and thanks for joining me. My name is Hans Bruhn, and I'm a risk manager at Ophthalmic Mutual Insurance Company, also known as OMIC. Today, I'll be taking you through approximately 30 minutes of material on the topic of Risk Management 101. Why this topic? Well, when we look at medical malpractice claims, we want to provide you with information to help you identify when that type of liability risk is being created, as well as strategies on how to mitigate that risk as you provide care to your patients. What is medical malpractice and what is a claim specifically? It is an allegation of negligent care or the failure to render appropriate and timely care. There are legal elements of a medical malpractice claim, and those are a breach in the duty of a provider or an MD to treat a patient. There is a deviation from the standard of care that is what a reasonably prudent physician, or in this case an ophthalmologist, would do in the same or similar circumstance. There is a direct causal relationship between the deviation of care and alleged injuries by the patient or plaintiff. And lastly, there are damages, both economic and non-economic. When we look at allegations of negligent care, we can look at it from the standpoint of the patient and how they can create that liability risk for you and your practice. It can be through their no-show and cancellation behavior. It can be through a patient's non-compliant behavior. And I'll go into more specifics on that a little bit further into the presentation, as well as just the perception of a patient that you have abandoned them and not rendered the care when they needed it to be provided. From a physician or a practice standpoint, there has been a failure to follow preferred practice guidelines, best practices. At the American Academy of Ophthalmology, AAO, they produce preferred practice pattern guidelines on various surgical procedures as well as treatment to guide you on what is expected to render care using best practice guidelines. And lastly, standard of care precedent. When other cases have been tried in your area, a standard of care is developed, and that can influence your claim. So in both of these cases, both of these categories of the patient as well as the physician in practice, allegations of negligent care involve the failure to provide timely, appropriate, and prudent care. How probable is the event of a claim in your physician practice? Well, overall, in the population of all physicians, approximately 8% will be involved in a claim in any given year. Looking at ophthalmology specifically, you can see from the pie chart that 16% of ophthalmologists will experience one claim in their career, and that is a 30-year timeline of a practice. And on the other end, 3 or more claims will be experienced by 31% of ophthalmologists. So this will give you an idea of both what to expect from the probability standpoint, as well as to underscore the fact that it does occur. And even in best run practices, sometimes it will result in a claim because the patient's expectations are that they have been provided with negligent care. And that is the reason for coverage from an insurer like OMIC. How do we provide that care? Well, we look at the OMIC service to protect, prevent, and defend. Our underwriting group is focused on providing you with the coverage that you need based on your application, your credentials, your practice profile. And from there, the risk management group is there to help prevent a patient from being harmed as well as the prevention of a claim. When a claim does occur, the claims group is standing ready to defend with defense attorneys in your area. We also have resources available to provide risk management information. One source is through our confidential risk management hotline. It is a private line and information shared on that is not available to any other part of the OMIC company and staff. Both through email and through phone calls, we provide direct assistance on incidents that are happening in real time with you. We also do seminars and provide online courses on a variety of topics to provide more in-depth risk management information on a group setting. We have resources available on our website that are ophthalmic specific, such as retinopathy of prematurity, handling adverse events. We also do case studies on retina detachment, diagnostic error, co-management, anesthesia, and most recently, office-based surgery. We have ophthalmic specific consent forms to help guide you and provide you with aid in the documentation process. And lastly, we have non-compliant patient-specific advice as well as termination of care advice. This is just a sample of what is available on our website, and we invite you to explore further. We also do publications, the OMIC Risk Management Digest, as well as risk management bulletins on topics that we feel are happening in real time with you so that you are aware of their development. So again, I would invite you to our website, omic.com. Under the risk management tab, you will see the hotline issues that I mentioned, clinical issues, practice administration, consent forms, risk management recommendations, and even cyber liability resources. Here is some of our information and how it is organized on our website under clinical issues as well as administration. When we look at Risk Management 101, we're looking at really 4 areas to focus in on. And this is the overview of the 4 categories. In each of these areas, in-depth information is available on our website or through contacting the Risk Management Department at OMIC. The first area is understanding the physician-patient relationship. The second is managing that patient relationship effectively. Then managing the practice. And then lastly, incident management. Our goal in the Risk Management Department, as well as other service areas of OMIC, is to prevent patient harm, as well as to mitigate liability risk. The physician-patient relationship, the first area that I mentioned of that four-part summary, is to help you understand what the physician-patient relationship is, the definition of it. It is a mutually trusting relationship entered into and accepted by the physician and practice, and it is a commitment by the patient to comply with medical advice or to ask questions if care is unclear, and also to be educated on what type of care is needed. The importance of that relationship is that it enhances the quality of care being provided. It provides a dialogue under which and through which that care is provided. However, there are obligations. There is a duty for you as a provider, as well as your practice and your staff, to render care to patients once a physician-patient relationship is in place. If that care cannot be provided by you, it is important to educate the patient where that care can be obtained, the urgency of it, and the consequence of not getting that care. The start of a relationship is typically when a patient contacts your office and is provided medical advice, and an appointment is set. Through that appointment, there is an implied obligation to render care and an implied physician-patient relationship. The end of a physician-patient relationship is equally important. How to discharge a patient must be done in writing, using specific language that includes a notice with an effective date of that termination, or in some cases, the patient is terminating a relationship and you're confirming that. In all cases, no matter what the reason, a written notice to the patient needs to be provided, and that proof retained in the medical chart. Moving on to managing the physician-patient relationship, it's important to realize that effective management, again, enhances the excellent quality of care that can be rendered by your practice and you and your colleagues. It assists the healing process for that patient because of the communication and the exchange of information, and the overall improvement of outcomes due to the desire for you to manage that patient relationship effectively. How you do that is through documentation. And documentation of care, of course, documentation that is used in billing so that reimbursement and the financial obligation of the patient is met, as well as your financial management of your practice. Documentation of care also implies that there are policies in place that dictate how documentation is going to occur, the timeliness of it, and whatever system or method of documentation. Documentation, lastly, is very important when it comes to a claim. Defense of a claim relies heavily on the documentation that is gathered and accumulated on the care for that patient. Overall, poor documentation makes good care look bad, so it's very important that documentation be a very important part of your practice and is reinforced throughout your operations. Record retention, the documentation that is developed must be retained and maintained in your practice in a private and confidential setting. Retention guidelines exist by state and through federal guidelines that mandate how long records should be kept and how those records can be destroyed in a private manner. The overall access of medical records under HIPAA regulations, the confidentiality of that process is mandated and needs to be adhered to. At all times, a patient is entitled to their information, or they have the right to retain, authorize you to share that information with others. Managing the practice itself is really an overall concept of expectation management. It begins and ends with good communication. The communication that is provided when a patient is spoken to over the phone, an appointment is set, the expectation of what will happen when they come through the practice doors. Once they arrive, again, staff are interacting with them, their expectations, the expense of care, the out-of-pocket expense of care specifically is all explained to them very clearly and documented. And then lastly, the provider is also managing the practice by making sure that expectations of the care is explained again when they are meeting with the patient specifically. What interrupts that management of the practice effectively and the physician-patient relationship? Well, non-compliant patients often provide a distraction to that care. It is a situation where it can be a flag that there is lack of mutual trust in the relationship, and it can be seen in various ways. The hostile or difficult patient, the patient that does not pay their bill, and thereby is not satisfied with the care, or there are other circumstances, certainly financial situations that arise. But this can certainly be a flag. When patients are not paying for their care, it is important to find out why and to address whether it is care related. And lastly, non-compliant patients. Their refusal to comply with medical advice that you've given. It's important to find out why, but also to respect the fact that they may refuse care and that you document that fully to protect yourself against a liability claim. And in some cases, through all of these situations, it may be necessary to terminate the care relationship. So it's important to document and take action on any kind of non-compliant behavior. Referrals are another area where it's important to document that a referral has been made, or to document that you're accepting a referral, to manage the patient's expectations in terms of what will be happening when a referral has been made, where you are going and why, and to follow up on that referral to make sure it has taken place and that the patient has seen a specialist, for example, and to review the results of that referral and incorporate that information in a prompt and timely manner into the care plan if the care for that patient is being transferred back to you. To aid you in that is a simple tool at times, and there are other strategies that we have, but this tool illustrates how documenting the referral process can be aided. This is a form that you can give to a patient, have them sign it. It lays out specifically why the referral is being made and the urgency of that. They then sign the form again. You provide them with a copy of that signed referral form, and you retain the original in your chart. The referral note can also be used in the tickler file to make sure that you review the results, or you follow up with the patient. Did you go to the referral? Have we seen the results? So this is a very simple tool that can be employed in your practice amongst other strategies. Co-management and shared care, co-management of surgical patients, and general shared care with other providers is another area where management of that process is important. Not only the care that is being rendered, but the agreement between providers is very clearly documented, as well as the patient's acceptance of a shared care or co-managed arrangement. And then lastly, the care itself. Is that laid out with protocols to ensure that patients are referred to the appropriate provider when there are specific circumstances or complications? Is that all laid out so that there is not any situation where miscommunication has occurred that has delayed or distracted the rendering of timely and prudent care? Consent of co-management and shared care is important, as well as protocol to dictate how that care is going to be provided. After-hour calls and ER call duty is another area where the duty of a physician and the liability risk that can be created needs to be managed effectively. After-hour calls really can be managed effectively by using screening protocols so that whoever is taking those calls is going through a predetermined process of questions so that the patient is assessed and the proper level or urgency of care is determined. Again, ensuring timely and appropriate care. In an ER situation, the bylaws of the emergency room or hospital facility that is connected to will dictate how ER call duty is to be managed in terms of your expectation as a provider, for example, when your response time is expected, as well as whether you are required to respond to an ER calling you. If you're not on duty, you are not obligated to render call duty. However, there might be circumstances where the emergency room will call you because one of your established patients has presented there, And in those situations, you are expected to respond. Federal regulations, such as EMTALA, dictate how this process in emergency rooms will be handled. So another area is managing adverse events. An adverse event is a situation that has caused harm to a patient as a result of the medical care being rendered. It is one where it requires life-sustaining intervention and events that cause prolonged hospital stays sometimes. So in those situations, it's important to manage those events effectively so that both the patient and staff involved are helped. Here are some recommendations on how to handle adverse events. Focus in on the care of that patient, what care was provided and is needed as a result of the adverse event. Preserve evidence if equipment failure, for example, is involved. Disclosure to the patient or family of what has transpired. Documentation of the whole care process, what has occurred and what is going to occur, the plan itself. Reporting to outside parties or to outside agencies, depending on their requirements. Seeking advice through your insurance company, such as a risk manager like myself, to help you through that event. To notify the claims department if it has evolved into that type of a situation. So overall, to respond to the patient and regulatory agencies, and then analyze what has occurred so that there can be a prevention of recurrence, and follow up with the patient, follow up with the staff, so that whoever needs assistance can be provided with that. The last area is incident management. When an incident occurs that is definitely pointing towards a claim, or it can be an incident where you're not quite sure it's going to be leading to a claim. And as you would suspect, the advice I give you here is to contact us. Reach out to your insurance company, the risk management department, or the claims department, and we are there to provide you with that expertise and advice on next steps. And we do that in a confidential manner and realizing it is a personal matter. So we respect that event needing to be private, and we will handle the situation with you in that manner. So learn more about these topics discussed in this webinar on our website, and you can see the various topics that I went over. And in these documents, in these resources, we go into much more in-depth information on how to handle this type of liability risk exposure. And these are, again, designed to help you identify liability risk and mitigate that risk when it presents itself in order to prevent a claim. With that, I'd like to invite you to contact us if you have any questions. It has been a pleasure to present this information to you. And this concludes our presentation.